Hello, everyone. Did you know that a stroke can happen at any time, and if you delay just a few minutes, the consequences can be very serious? But if you recognize the early warning signs, you can save yourself or your loved ones. Pay attention to the following dangerous symptoms to act promptly. Don't miss it. The first reason we will talk about is the symptoms. Blood clotting disorders can increase the risk of stroke, especially stroke caused by a blockage in a blood vessel, ischemic stroke. This occurs when blood clots more easily than normal, blocking an artery in the brain and causing a stroke. Some disorders, such as antiphospholipid syndrome, APS, or factor V Leiden, can make blood clot more easily, causing a clot in a blood vessel in the brain. Conversely, some conditions, such as hemophilia or severe thrombocytopenia, can cause bleeding in the brain, leading to a hemorrhagic stroke. Therefore, if someone has a blood clotting disorder, they need to be closely monitored to control their risk of stroke. 2. High blood pressure. High blood pressure is the leading cause of stroke because it damages the blood vessels in the brain in many ways. When blood pressure is too high, the blood vessels in the brain can rupture, causing bleeding in the brain. This condition is more dangerous and can lead to cerebral edema, coma, or death. Prolonged high blood pressure can cause blood vessels to dilate abnormally, forming an aneurysm. When the aneurysm ruptures, blood flows into the brain, causing severe cerebral hemorrhage. High blood pressure causes heart failure, atrial fibrillation, making the heart pump blood ineffectively, easily forming blood clots that cause stroke. High blood pressure damages the blood vessel walls, leading to the formation of atherosclerotic plaques that block the cerebral arteries, preventing blood from reaching the brain. Therefore, we need a guaranteed regimen to maintain good blood pressure, which you can watch in our video posted on the Be Health channel. 3. Diabetes mellitus increases the risk of stroke 2 to 4 times compared to normal people. The reason is that diabetes damages blood vessels, heart, and blood clotting, leading to blockage or rupture of blood vessels in the brain. Diabetes increases blood fat. Fat accumulates in the blood vessel walls, narrows and hardens arteries, reducing blood flow to the brain. High blood sugar also increases platelet adhesion, easily forming blood clots, causing blockage of cerebral arteries. Damage the endothelium of blood vessels, making blood vessels brittle, weak, and easily broken, causing cerebral hemorrhage. When having a stroke, people with diabetes may not recognize the early signs: mild paralysis, weakness on one side of the body, leading to delays in treatment. 4. Cardiovascular disease. Cardiovascular disease increases the risk of stroke by 2 to 5 times because it directly affects the circulatory system, causing blockage or rupture of blood vessels in the brain. Stroke can occur when the heart pumps blood ineffectively, forms a blood clot, or blood pressure is too high. Cardiovascular diseases such as atrial fibrillation increases the risk of stroke by 5 times. Myocardial infarction. People with myocardial infarction can have a stroke. Carotid artery stenosis reduces blood flow to the brain, making it easier to cause a stroke. Heart failure. The heart pumps blood poorly, causing a lack of oxygen to the brain. Heart valve disease makes it easier for blood clots to form and block arteries in the brain. Reduce the risk of stroke in people with cardiovascular disease by controlling blood pressure below 130/80 mmHg. Taking anticoagulants if there is a risk of blood clots, as prescribed by your doctor. 5. Infections. Infections, especially chronic infections or severe acute infections, can increase your risk of stroke in several ways. Bacteria, viruses, or excessive inflammation can damage blood vessels, form blood clots, or disrupt blood pressure, leading to stroke. When the body is infected, the immune system triggers an inflammatory response. Chronic inflammation can damage the lining of blood vessels, allowing plaque and blood clots to form, blocking arteries in the brain. Infections that increase your risk of stroke include bacterial or viral pneumonia, COVID-19, severe influenza, pneumococcal pneumonia. Sepsis. Infective endocarditis, infection of the heart valves. HIV, hepatitis, tuberculosis, which cause chronic inflammation that damages blood vessels. Diseases caused by herpes viruses, such as shingles, herpes simplex. To reduce the risk of stroke when infected, we need to treat the infection promptly and not let the disease prolong. 6. Dyslipidemia. Dyslipidemia, also known as high blood fat, abnormal blood lipids, is one of the main causes of stroke, especially ischemic stroke. When blood fat increases, it will narrow the arteries, form blood clots, and obstruct blood flow to the brain. The most dangerous types of dyslipidemia are high LDL-C, increased bad cholesterol, causes atherosclerosis, blood vessel blockage. Low HDL-C, reduced good cholesterol, reduces the ability to protect blood vessels. High triglycerides, increases the risk of vasculitis, blood clots. High LDL/HDL ratio, a sign of severe atherosclerosis. How to reduce the risk of stroke in people with dyslipidemia. Control LDL-C below 100 mg per deciliter or below 70 mg per deciliter if you have cardiovascular disease. Increase HDL-C above 40 mg per deciliter men and 50 mg per deciliter women. Maintain triglyceride levels below 150 mg per deciliter. 7. Cigarette. Cigarettes contain more than 7,000 toxic chemicals, including nicotine, carbon monoxide, CO, and tar, which can damage blood vessels, increase blood pressure, and promote blood clot formation, all of which are major risk factors for stroke. Nicotine in cigarettes accumulates bad cholesterol, LDL-C, in the arteries, narrowing blood vessels and possibly rupturing, leading to blood clot formation, causing blockage of blood vessels in the brain. Nicotine stimulates the nervous system, increasing blood pressure and constricting blood vessels, making blood vessels narrower. Smoking increases carbon monoxide, CO, in the blood, reducing oxygen to the brain, making brain cells vulnerable to damage. Therefore, after 1 year of quitting smoking, the risk of stroke is reduced by 50% compared to smokers. After 5 years, the risk of stroke is almost the same as that of non-smokers. The sooner you quit smoking, the faster your blood vessels recover and the lower your risk of stroke. 8. Alcohol. Alcohol directly affects blood pressure, cardiovascular system, liver function, and nervous system, increasing the possibility of blood clots, atherosclerosis, or rupture of cerebral blood vessels. When drinking a lot of alcohol, blood pressure increases suddenly, creating conditions for blood clots to form, causing stroke due to embolism. Alcohol damages the liver, reduces the production of clotting factors, making it difficult for blood to clot when a blood vessel ruptures. This makes cerebral hemorrhage more serious, increasing the risk of death. To reduce the risk of stroke due to alcohol, we need to limit alcohol. If you drink alcohol, you should only drink in small amounts, not drink regularly, and should exercise and eat healthily to protect blood vessels. 9. Unhealthy diet. A poor diet, especially one high in fat, sugar, salt, but low in vegetables and fiber, can increase the risk of stroke by causing obesity, high blood pressure, diabetes, dyslipidemia, and atherosclerosis, all of which are leading risk factors for stroke. Fatty foods, fried foods, fast foods increase bad cholesterol, which will accumulate, forming plaque in the arteries, narrowing blood vessels and making them more likely to become blocked, causing stroke. Sweets, carbonated soft drinks, and candy increase blood sugar levels, which lead to diabetes. An unhealthy diet can easily cause weight gain, obesity, making the heart work harder, leading to high blood pressure and dyslipidemia. To prevent stroke through diet, we need to supplement with lots of green vegetables and fruits rich in vitamin C, potassium, and fiber to help protect blood vessels. Limit fried foods and animal fats. Replace them with healthy vegetable oils like olive oil. Cut down on sugar, limit soft drinks, and candy to prevent diabetes. 10. Stress. Prolonged stress not only affects the mind but is also a serious risk factor for stroke. When the body is in a state of constant stress, the hormones cortisol and adrenaline will increase, causing high blood pressure, heart rhythm disturbances, increased blood sugar, and blood vessel inflammation, all of which increase the risk of blockage or rupture of blood vessels in the brain, leading to stroke. When stressed, the nervous system stimulates vasoconstriction, causing blood vessels to dilate excessively. If the blood vessel wall is weak or there is an aneurysm, sudden high blood pressure can cause blood vessels to rupture, causing brain hemorrhage. Control stress with meditation, yoga, or listening to relaxing music and get enough sleep. Maintain quality sleep to reduce cortisol. This video warns of the signs and symptoms of stroke. We hope it is useful to many people. In the next video, we will share about stroke prevention methods. Please follow and watch. Goodbye and see you again.